The number one best remedy for heart attack. Welcome to my channel. I'm going to share with you a very simple remedy that you can take to prevent a heart attack or reduce your risk of a heart attack. You know, the heart is among the top 5 organs, and a heart attack is simply when the blood supply to the heart muscle is blocked. Therefore, there is shortage of oxygen, and you feel a tight chest pain, and usually it ends in the collapse of that individual. And the main cause of a heart attack is coronary arterial disease. Heart attack is the number one killer globally, and the purpose of this video is help to identify the best remedy to prevent or reduce significantly your risk of a heart attack. Now, this remedy is number one, a powerful antioxidant. Number two, it is a potent anti-inflammatory substance. It is naturally present in many foods in small amount like the poultry, beef, fish, nuts, legumes, and grains. It is also added to some food products and also available as a dietary supplement. So what is the number one best remedy for a heart attack? This remedy is one of the water-soluble vitamins and is called niacin. That is vitamin B3. Niacin is the number one best remedy for a heart attack. Is it just any vitamin B3? The answer is no. I'm going to tell you the version of vitamin B3 that prevents and reduces the risk of a heart attack. Now, this knowledge is not very popular at all from the pharmaceutical world and the medical field because buying this type of niacin or vitamin B3 is so cheap. It is not profitable and they won't make a lot of money from it. So vitamin B3 is silenced whilst they prescribe statins. And unfortunately, statins do not prevent or reduce your risk of a heart attack. This also many don't know, including many of our healthcare professionals. Before I tell you the version of vitamin B3 for a heart attack, let's look at some studies on niacin and why it is the best choice for a heart attack. Number one, niacin lowers C-reactive protein, that is CRP. CRP is a pentameric protein synthesized by the liver whose level rises in response to inflammation. Even though CRP has some anti-inflammatory properties, it also has pro-inflammatory property. That is, it makes the inflammation or a disease worse than initially it was. And that is why it is a strong predictor or initiator of mortality or diseases. It is a very strong independent predictor of a heart attack or myocardial infarction, peripheral vascular disease, and stroke. If there's high level of this CRP, inflammation will increase when plaques or clots form in the arteries as oxidation is taking place. And the beautiful thing about niacin is that it suppresses the oxidation and vascular inflammation, which is strongly linked with a heart attack. Therefore, niacin reduces the level of the CRP, and the effect is that it rids you of the vascular inflammation, making it a potent cardiovascular protector. Number two is niacin significantly treats hyperlipidemia and dyslipidemia. That is, it lowers your cholesterol, especially the oxidized LDL. This type creates inflammation. And studies conducted since the late 1950s show that niacin increase HDL, that is the good cholesterol, by 10 to 30% and reduce low density lipoprotein, that is the bad cholesterol levels, by 10 to 25% and triglycerides by 20 to 50%. So it prevents the lipids and the fat from depositing on the walls of the arteries, slowing and reversing arteriosclerosis, which is a major contributing factor to the obstruction of blood supply to the heart, which causes a heart attack. Number three, niacin lowers white blood cell reaction in the inside of the arteries, especially in the case of arteriosclerosis when you are dealing with inflammation. It also lowers monocytes and other white blood cells and the inflammation that comes along with within these arteries. And number four, niacin prevents endothelial dysfunction and reduces the adhesion that form in the inner layer wall. Having looked at all these evidences, we get to know the version of vitamin B3 that is recommended for preventing, reducing the episodes and your risk of a heart attack. The number one best remedy for a heart attack is the extended release niacin 500 milligram version. This is the one you should take and not any other niacin for a heart attack issue. This is the one recommended version and dose. Any other version for heart attack comes with some side effects. The extended release version, that is 500 milligram, has no side effects. The others do. So if you are concerned about your heart, have any condition that can increase your risk of heart attack, or have suffered one in the past, then I recommend for you niacin, the extended release version, 500 milligram per day for months to years. If you have not seen this video on heart attack, check it out right now. Thanks for watching. Your health, your life. God bless you.